Good morning. This is a video to explain how nerve agents function and why they are so deadly. Nerve agents originate from insecticides. They are highly potent and have been misused in the past for assassinations, terrorist attacks during warfare. For example, Taliban and sarin gas were first used in the Iran-Iraq war between 1980 and 1988. Thousands of people were killed and even more were injured. In 1995, homemade sarin gas was used in a terrorist attack on the Tokyo subway. 13 people were killed and over 5,000 were injured. Most recently, the nerve agent Novichok was used in an assassination attempt on Sergei and Yulia Skripal. The police officer first to arrive to the scene was also in a life-threatening condition, but all three have now managed to recover. Unfortunately, a couple of months later, a person unknowingly picked up the perfume bottle used to transport the nerve agent and died due to the exposure. All the victims from these events showed similar symptoms. A person who has been poisoned by nerve agents will present a few or all of the following. They might have seizures. They may lose consciousness. They can stop breathing, also known as apnea. The pupils may constrict, also known as pinpoint pupils. Hypersection of the lacrimal glands in the eye, salivary glands, sweat glands, and bronchial glands in the airway can occur. This causes tears, frothing at the mouth, profuse sweating, and airways being blocked with mucus. The airways can also constrict and narrow. Episodes of fast heart rate, known as tachycardia, and episodes of slow heart rate, known as bradycardia, may occur separately or periodically after one another, which leads to heart arrhythmias. Convulsions may start and smaller localized muscle spasm can occur. The victim may also feel nauseous or start to vomit, and they may face urinary and fecal incontinence.
So, why do these symptoms present? Well, to understand that first of all, you have to understand how a normal nerve synapse works. For nervous impulses to travel around the body, they have to pass over gap between neuron core synapse. At this synapse, the arriving nervous impulse trigger to release of neurotransmitters such as acetylcholine into the synaptic cleft. Acetylcholine binds to the type of receptor on the post-synaptic terminal on the other side of the cleft. These two types are muscarinic receptor, which, of example, trigger involuntary muscle contraction for smooth muscle, and nicotinic receptor, which can trigger voluntary muscle contraction for skeletal muscle. Acetylcholine is then quickly broken down by the enzyme. Acetylcholine split into two parts, choline and acetic acid. This stops the impulse. The choline is then reabsorbed into the synaptic terminal and recycled. So, how do nerve agents affect this? Well, typically there are three ways a nerve agent can enter the body. First, inhalation, ocular absorption, or skin contact, and injection. Different nerve agents have different severity of symptoms depending on the dose administered. When the nerve agent reaches the synapse in the body is active component and organophosphate currently bound to the binding site of acetylcholine. This bond is permanent until reversed by an antidote. Acetylcholine can be broken down and so accumulate in the synaptic cave. With more acetylcholine building up the receptor on the post-synaptic terminal become overstimulated and the neuron continually send on nervous impulse
ต่อ
muscarinic, nicotinic or a combination of both receptors can be overstimulated, producing the different symptoms in the victim.
How should we treat this life-threatening symptom? First of all, only trained personnel should approach the contaminated site and attempt to treat patient. When it comes to treating the symptom, the severity of the symptom depends on the route of exposure and dose of the nerve agent. Immediate treatment options are split in two categories. Combating the nerve agent directly to reduce its impact on the patient, and stabilizing and supporting the patient. To combat the nerve agent directly, you must remove the patient from the contaminated area and remove all contaminated material. Knowing the route of exposure is important, as this will inform you that if the patient is still in contact with the source. Atropine is a competitive inhibitor of the nerve agent and will prevent it binding to the acetylcholinesterase. This must be administered quickly in order to be effective, as it will not inhibit organophosphate that have already bound with the acetylcholinesterase. Pyridoxine choline is the antidote of the nerve agent poisoning. It will allow the regeneration of acetylcholinesterase by binding with the organophosphate and removing it. To stabilize and support the patient, you must consider the most life-threatening symptom. If the patient is struggling to breathe, dry the airway, and move the patient so that any saliva or mucus blocking the airway and can drain away. If in respiratory arrest the patient, you need an artificial respirator and oxygen. Salbutamol can also administer to relax the smooth muscle and widen the airway. The patient suffering from convulsive and seizure may be at risk of hurting themselves. You can try and protect them by padding out the surroundings. Diazepam can be administered to stop seizure and convulsion. We hope you have been able to learn something about nerve agent today. Thank you for watching.
Goodbye.
Goodbye.
Bye.